My name is Arielle V. King, and I'd like to welcome you to our panel. To start off, I would like to have you all think about a piece of art or music that has inspired you or even caused you to donate, take action, or think about researching something. And here are a few that you may or may not remember. First is We Are the World from 1985, Shepard Fairey's We the People posters, Free Nelson Mandela, or a more recent example being Macklemore's Hind Hall. So we know the power of art and music to inspire grand-scale efforts, drive donations, and influence political support. And so today we'll discuss how we can harness this power to convey complex messages about climate change and public health to new audiences and those most affected by these issues. We've gathered today an absolutely incredible and brilliant dynamic panel to help and talk about these topics today. First, we have Dr. Olajide Williams, Vice Dean of Community Health at Columbia University and co-founder of the Hip Hop Public Health and with Dougie Fresh. He was a stroke expert at New York Presbyterian Hospital and Columbia University, dedicated to tackling healthcare disparities and enhancing diversity in medicine. Next, we have Dr. John Whyte, who serves as the Chief Medical Officer at WebMD, where he drives efforts in public health strategy and digital health solutions, leveraging his diverse experience and earning recognition as a leading health influencer. Next, we have A.Y. Young, who is a singer, songwriter, producer, and UN Youth Ambassador. He founded the Battery Tour, becoming one of the first artists to power concerts 100% with renewable energy to educate the public and raise funds for sustainable solutions. Last but not least, we have Sara Espinoza, who is the president and CEO of the National Environmental Education Foundation. She drives strategic leadership and growth and has a background in conservation, education, and public engagement. When we talk about reaching audiences, we're focusing on two dimensions. First is how to address topics like climate change with audiences who might be hesitant or resistant. And second is how to engage those who are often left out of the conversation. With these two dimensions in mind, I want us to explore how creative tools like art, music, and partnerships can help reach those who might be hesitant or left out of the conversation. So, AY, I want to start with you today. Hello.
On the spot.
So AY and Dr. Williams, both of you have successfully integrated music into your respective fields to engage youth on very important issues. So what inspired each of you to use music as a tool for promoting sustainability and public health? Can you perhaps share a moment or experience that sparked that journey for you? And so AY, would you like to kick us off with that?
I feel like I've had multiple moments, but I think one moment where I really saw like music not only as a universal language, but it's like the key to power impact was here. I think I was in like Honduras, maybe I was in Haiti, and I was doing these concerts, and it was like places that, Justin Timberlake doesn't go because it was more like venue, you know what I mean? Like it's like their first concert was the Battery Tour, and I remember seeing women like walking, and they had water in their head, and they're like walking for miles, and the guy's like, yeah, they gotta walk 4 or 5 miles for clean water. It's like, it's crazy, guys. Like, it's insane. And I think I remember wrapping the concert, and I remember literally people in the village were crying, and that was like the moment when I realized like this is something special. Like music not only has a way to reach people that I can't even speak to, but has, gave me the ability to raise money and to be able to promote, develop, deploy solutions to people who need it. For me, that was like my immediate moment of like, okay, music for impact.
Yes, and when did you decide that music was what you wanted to pursue professionally then?
I mean, I've always had music. I don't know if I ever decided I just make music. I love music, It's like my vehicle.
Beautiful. And Dr. Williams, how about you? Was there one particular moment that sparked your desire to combine music and public awareness and public health issues?
So one of the moments was actually unconscious, and retrospectively, I realized that it actually was a moment, and that is when I was in high school, and that song that you had up called "Free Nelson Mandela" by the Specials, it came out in 1984. So I'm giving away my age, but that's okay. But at that time, as a high school kid, I wasn't I wasn't socially conscious. I wasn't really interested in politics or social movements. I just wanted to have fun and learn and make sure I stayed out of trouble. And that song came on, and it kind of changed my life in a way that only later did I begin to realize the impact it had on me. It did a couple of things. One, it taught me about apartheid South Africa. I went to high school in England. And at the time, the only information that we had about apartheid South Africa was really top-down, controlled, curated information. And that song was the first time the information came up from the streets, came up from the grassroots. And it threw Nelson Mandela into my consciousness, literally catapulted him into my consciousness. And I began to wonder, who is this man? What is apartheid done to him? So I began to really just learn more and more about the topic, and the injustice just threw me an uppercut, and from that I was just rocked into believing that I had a responsibility to participate in the protests. Fast forward, I'm now a professor of neurology, studying the brain, and I use music to heal my patients. Just a practical example. We have a treatment for stroke called melodic intonation therapy that teaches patients how to speak again through music. We have a treatment for our dementia patients who are having delirium, who develop a state we call agitated delirium, that we use music to kind of heal and calm them without having to restrain or medicate them. The reason why music has these myriad effects on our systems, cells, bodies, minds, is because neurologically, music actually occupies twice as much real estate inside the human brain than language itself. Imagine that. That's why music helps reduce our stress, inspires, and all the things that music does in all of our individual lives. It's rooted in that representation that it occupies in the brain.
Yeah, thank you for that. I did not know that at all, but it makes a lot of sense. And I feel like, that also lends to this quote that I love. It's just like, an artist's responsibility is to reflect the times, right? And I think that so many of the examples that we showed here and so many others are very clear examples of the ways that artists and art and music are an opportunity to showcase what is happening and to invite more conversation. And so, AY, you've performed in schools and stages across the country and world, including places where there might be some resistance to your message. Can you share a particular instance where you were faced with such resistance and how you navigated it to still deliver a meaningful impact?
Well, I mean, in some ways, I'm kind of faced with resistance all the time.
Right.
To be very honest, I'm not doing traditional touring. Like traditional touring, you go to a venue, it's tied to the grid, you perform. Right? I just did Times Square, and that's share 950 or powered 100% by clean energy. So in a way, I'm doing the opposite of what the music industry and the structure aims for me to do. So it has been very difficult, but that's why I believe in radical collaboration. Like the same way as I've been, really helping get boxes, energy boxes of food to people in need along the world is the same thing I believe in for progress, and that's collaboration, finding organizations like NEEF that do the work and partnering with them to then execute this vision, right? And it's kind of beautiful because, now I'm looking at the music industry and seeing like Massive Attack and Coldplay and Barry Eilish are now kind of following was like we that I've said since 2012, and like we can decarbonize the music industry, we can shoot film differently. You know what I mean? We can use alternatives to the diesel generator. It's a beautiful thing.
Absolutely. Thank you. And I'm curious, and anyone can answer this, how can some of these things be applied to communication overall as we're communicating complex topics? What are some of the ways that we believe that connecting to things that are resonant and relevant can help with communicating these complex topics in general?
I can just say very quickly. So at Hip Hop Public Health, we you know what? I'm just gonna borrow Aristotle here very quickly. So Aristotle talked about the art of persuasion a lot, and he talked about the 3 pillars of persuasion. So he talked about logos, which is persuading through logic and data and facts. He talked about ethos, which is persuasion through credibility. And he talked about pathos, which is persuading through emotional connectedness. And of all those 3 things, Maya Angelou summarized the most important one, which is pathos. It is not what people tell us, it's how people make us feel that moves us to act. And that's what music does.
Exactly. Thank you. And Sarah, I want to move over to you. So NEEF has collaborated with the Hip Hop Public Health and AY Young on projects that use music to engage students in sustainability and reach youth with asthma. Can you discuss the decision to partner with both of these incredible entities and individuals, and what do you seek in a prospective partner at NEEF?
Sure. Yeah. Well, I think we just hit on it a little bit, which is NEEF exists to make the environment more accessible, relevant, and connected to people's lives. And we really want people to have information that helps them make decisions about their own health, the health of their communities, and the environment. We can't do that without partnerships. And in fact, I feel strongly that one of the best things organizations like NEEF can do is recognize that we often are not the most effective or trusted messenger when it comes to climate change and health, and that these types of partnerships and collaborations are really critical to getting messages and information, particularly to communities that have been marginalized from the environmental movement for a really long time. I'll give you 2 kind of quick examples of the work that we've done together. The first is the collaboration with Hip Hop Public Health. NEEF has been working with healthcare providers, doctors, nurses, community health workers, school nurses for about 20 years to identify and manage the environmental triggers of pediatric asthma. And one of the things that we were hearing from the providers we were working with is that they did not have educational materials that were relevant to their patients and caregivers. Black youth are twice as likely as white youth to be affected by asthma, but they don't see themselves represented in the visuals, in the posters that are in the medical offices. So that's one of the reasons that we worked with Hip Hop Public Health, was to create this Empower series that many of you saw playing at the beginning. Really catchy tracks, representative visuals that give these providers and caregivers and parents ways to communicate with young people about their health and how they can really take control of their own health and work with their community and people around them to manage their asthma. So that's one example. The other is the collaboration with AY around Climate Superstars. Our friends from Samsung are here in the room. It was a partnership with them to develop a series of educational activities for middle school students. And again, science is exciting, but the opportunity to win a concert from AY Young is more exciting and motivating to participate in these challenges. AY created a task for young people around taking energy-saving behaviors and climate-friendly behaviors. That was one of the most popular tasks. And ultimately, there were winning schools in each of the years that we ran that program that had a concert, a live performance from AY. And for many of those kids, it was the first live performance they had ever been to. I think it's safe to say I don't remember a lot of things I learned in middle school, but I do remember my first concert. And it goes back to exactly what you were saying. It's that emotional connection. So when we're looking at partners, those are the kinds of value add collaborations we're looking for. We have the content, we have the information, we have the environmental education expertise, but we don't have that reach and creativity and voice with some of these communities that our partners can really bring to the table.
Thank you. And I have a question about the ways that we share that information. So perhaps any of the panelists can share what are some of the ways that we extend the reach of the work that you are doing, and what are how do you seek out your target audiences? What are some of the ways that you collaborate with individuals and with entities to be able to spread awareness about the causes that you're championing? Dr. Whyte, do you want to?
Sure. The first thing I want to say is, better information leads to better health. Yes. And I think that's especially relevant nowadays when there's a lot of misinformation out there. But what I learned over, my 6 years plus at WebMD is also that you need to meet people where they are. So in the past, where you could just build a website and expect people to come, like it's a baseball park. Field of Dreams, in case you need that reference, is that just doesn't work nowadays. And I'm not sure it ever really worked. So this idea that you meet people where they are, whether it's music or other forms of entertainment, and you make education not just informational, but also entertaining. And a lot of times in terms of healthcare professionals, and I'm one, is we make everything so complicated. We parse it so carefully. We use words that people don't understand. And then we wonder, why they're not changing their behavior. And I think this is something that I've learned by listening to these folks and learning about what they're doing is it's not a one message fits all approach. So when you think about, who's your audience, how do you think about it? The first issue is, who is your audience and how do they like to consume information? And what we've also learned, over the past few years with YouTube and Instagram and social media, that a lot of folks have challenges in the healthcare field is it's okay to just give some nuggets of information. You don't have to teach everyone all the aspects of asthma, at that first visit or that first piece of content, that you get them interested. Just as the others have pointed out, you get them focused on how it impacts their life. And I think with climate, people are starting to see that when it's bad air days, how that makes you feel in terms of your breathing, how it might limit your activities. Honestly, I don't think that's something that we thought about 10 years ago, 5 years ago. So much of it is about knowing your audience and then meeting them where they're at. And for many people in the healthcare field, that's still a challenge.
I think it would be John, that was really excellent. One of the other strategies regarding John's last point, knowing your audience, is actually inviting your audience to co-design those messages and the approach and the strategies. Because if they're not at the table, you're going to miss the nuance that could make or break a particular program. So a quick example is that Bobby Fresh, who helped me co-found the organization, we wrote a song in 2006 called Stroke Ain't No Joke. The reason why we wrote this song, because at the time I was working, spending a lot of time as a stroke physician in emergency rooms at Harlem Hospital. And we had just, we have a treatment for stroke at the time which needs to be administered within 3 hours from the onset of symptoms to the time it can be administered. We were treating about 2% of the patients coming into our community from Harlem. We said, why are people coming in on time? We have this treatment that could potentially reverse your disability, and you're not coming in on time. And then we did a deep dive in root cause, and we found out that a lot of it was driven by low literacy around stroke. They didn't recognize what was happening to them. They didn't know that they needed to act fast. So we wrote the stroke at no joke song. We put in the symptoms of stroke and the action that needs to be taken if you experience any one of those symptoms. And we actually quadrupled treatment rates. We had young children recognizing stroke in their parents and their grandparents call on 911, overruling decisions to go lie down or take an aspirin because of the soul. We ran a randomized controlled trial because of the pilot data funded by the NIH that showed that this was indeed working both at the pediatric level and at the parental level and when it comes to stroke treatment outcomes.
And I was just going to add that, and this is all about the concept that they're making learning fun.
Absolutely.
We're not making it seem like a task.
Right.
And it's something that they have to do. And that's how they're going to retain that information with a catchy song that we all can play in our head, or mnemonic as we often use in learning. But I love the whole idea that you're making it fun, and to your point, they're measuring it and showing success so other people can replicate it.
I think one of the other things I would add that you just hit on, Dr. Williams, is that these connections and the excitement that's driven by music and content gives young people in particular a feeling of agency, and that there is action they can take to address these issues that they're feeling very anxious and concerned about in their lives, and quite frankly, sometimes kind of disappointed with the adults around them. And we've seen this happen in Climate Superstars. We saw a group of students in Michigan successfully lobby their school to replace the paper towels with hand dryers in the bathrooms, and there was a story about it. It becomes a very empowering message that I can do something, I can act, and I have the agency to do this for myself and for my community.
And that feels especially important for young people under 18 who can't vote, right? And feel extra disempowered because they feel like there's not anything that they can do on their own. And so, yeah, and that's why programs like Schoolhouse Rock were so successful, right? And that's why most of us can still recall so many of those songs because of the power of music and what that can create for us. Let's see. Dr. Whyte, your content spans a wide range of topics, from podcasts on happiness to heart failure and women surviving migraines, multiple different types of care. So how do you make scientific information accessible to a large audience or the general public? I know you answered a bit of that already. And do you see a role for a wider range of communication forms such as art for topics like these?
So something that, when we're talking about, Sarah and I have talked about, and some others, is, when it relates to, say, a topic like climate, we don't want to just preach to the choir. By that I mean, we just don't want to empower all the people that are here that are already kind of self-selected to recognize the importance of climate change and the impact of the health, but to try to convert those that are not yet believers in the role of climate. And I think that the way that you do that, as we've talked about, is you help them understand why it impacts them and it impacts their health. I had mentioned to Sarah, I went to the Climate Week Initiative yesterday here in New York, and they were talking about the impact of climate on maternal health. And that's not something that I really knew about, to be honest, and I'm interested in this topic, that now in certain areas of the country and the world, we're having 120 degrees, 130 degrees. We didn't have that 10 years ago, and how that impacts the body of a pregnant woman to thermoregulate, herself and now the child. It has real impact, but we have to get that information out there, and everyone's not going to come to, as I said, a website or attend a lecture. So how do you help them learn? Through entertainment, through other forms of media that can be just as, if not more powerful, but you have to bring it back to them. And how does it relate to them? So I love the example of the school that they're changing in their bathroom. Now, I don't know, by the way, if hand dryers are about it now. But I still love the concept that they're trying to do something, and you want to empower people to make a change and make them feel they have that ability. But you have to start with letting people know how it impacts them and their lives and their health. And I'm going to be honest, I'm not sure if we're really there in terms of the general population, in terms of what we need to be doing. So the environment is still here for our children and our grandchildren.
Yeah, absolutely. Does anyone else have follow-up or thoughts, reactions before we move forward? So my question is, what would you love to see organizations and supporting ecosystems do to ensure that people understand climate and or health in the most actionable ways possible? Dr. Williams, can I start with you?
So what do I like to see organizations do?
Yeah.
That's a big question, man.
Yeah.
Wow.
It's however way you see fit. Yes.
I think that I think it's important for every organization across the entire socio-ecological spectrum, regardless of the sector or industry that you come from, to recognize that climate change affects all of us.
Yeah.
And to make sure that every organization does at least one thing, just one thing, to address the issue. And if everybody just does a tiny little bit, it will reduce the need for folks to do a lot. So I would ask every organization, regardless of what field you are in, to find one thing that you can do for the environment.
Thank you. Thank you. And that really just speaks to the power of collective action, right? Like a bunch of individuals working together on a common goal. So thank you for that. AY, do you have thoughts or reflections on that? You sure can. So Dr. Whyte, can I pass to you?
Sure. I would agree with that. I think when we think about the impact of climate change on the world, it can be so overwhelming. Like, what can I do as an individual or as a family or as a community to really have an impact on climate change? Mm-hmm. And I think that's where we have to give people resources and ideas on how they, as individuals, as a community, can make that impact and why it's so important. I think we have to acknowledge that there are many people that don't believe the impact of climate change, and how do you have a productive, respectful conversation that helps move them? And I think by talking about many of the effects on people's lives, both personally and professionally, and just having that in multiple format. But I agree about this idea that really empowering communities, organizations with the ability to do one thing that will have an impact.
Mm-hmm. Yeah, I mean, and I believe that is one part of like climate and environmental justice is this reinforcement of the value of self-determination for those who have been most impacted, right? So it's like, how can these organizations create avenues and opportunities for the communities most impacted to become more a part of the solutions because they are the ones who know their communities best. So,
and I will just also say, I think it is about having more of that discussion around climate, as Sarah is doing, and I'm happy to be part of the NEEF board because I would say as a clinician, when we talk about health, there are so many other issues when we talk about social determinants of health, about access to fresh fruits and vegetables, about access to the ability to have a safe place to exercise. I'm going to be honest, I'm not hearing enough about the impact of climate and how it impacts your health. Yeah. So we have to pull that in to this discussion when we're talking about some of these other determinants of health.
Just want to quickly add that at Columbia, for example, we were doing a redesign of our medical student curriculum, and the students actually were the ones who said, you guys need to put a climate curriculum in there. And this is, we teach people heart disease, stroke, cancer. They're like, you guys got to put a climate because that has a powerful effect on health. And that's one thing that we're doing at the medical school. It could be a conversation that you have annually or part of a forum. But I think that everyone should have the opportunity to do one thing. I think organizations like NEEF and climate justice organizations should help facilitate ideas for what people can do in that one thing that they can do. Because maybe they know where to start. Right. And I think that's where leadership comes in. These are the options that you have. Everyone can do this, and you need some resources to do that.
Yeah, definitely. You guys?
Yeah, and I was like thinking of how to answer that question. And then, yesterday I was talking a lot with Peter J, but I was at CGI, Clean Global Initiative, and I was just taking me time, because today I do a big performance with Clinton and Bill Gates and everybody, would be awesome. Because I'm on this road to 1,000. Right, I'm gonna break a Guinness World Record, the first artist in the history of electric music to do 1,000 concerts powered 100% by renewable energy. We are. He rode in Times Square like a day ago, right? And I got this project, right, where I've made like one song for each of the girls, with SDGs, and a lot of people say, man, this is like 17 We're the Railroads, because it's one song for each girl, I'm lining with the sponsor and organizations that do the work, because we're donating all the profits to people that do the work. And I started hearing you saying what we were saying, it made me think about like, climate change is such a big thing, but when we bring this project to the kids and to the people, I use the family with the girls to say, okay, look at the girls really passionate about taking action. So around the grid, I already have millions and millions and millions of kids and people taking an action because they're like, oh, I can do something for good health and wellness. I can take an action every day and donate my time in the food kitchen. And now climate's certainly not that big. You know what I mean? And you're like, well, what do organizations need to do? And like when I get on that stage and every day this week, I would be saying like, I was going to say, tell organizations support music. I was going to say that, but I truly believe like adult leaders and organizations need to support initiatives like Project 17 because it's doing it and it's happening, literally. And the music is connecting to youth and getting them to take measurable actions now. So I guess it's like those two things. It's like, hey, use music, but also we need adult leaders to support solutions like this, right? And I'll say one more thing. I don't sound like Kanye. I was just with Kanye and he blew out of his madness. Yeah. Now he ran up to me. He was like, "You the technology guy." I was like, "Yeah, man, solar stone." The Weeknd donated like the Weeknd. Like he donated like I think $3 million or something to the World Food Program, right? And I'm a young leader. I'm under like the Secretary General. I'm under the 17, right, in the Under office for that. So I call World Food Program. Like the people that I knew it well, I was like, don't give me $50 million. Asking for like $100,000 in this time, right? And have them sing on the anthem for World 2. That be right? And if 70 million people buy the song,
that's real.
Exactly. Yeah.
You're gonna have it happening right now.
Love it.
By the way.
Very cool.
Do you guys remember the Ebola crisis? Well, there was a song so the Liberian government was struggling to get people to even accept that, Ebola was real or, the type of steps that needed to be taken to reduce the Ebola crisis. And so these two artists came up with a song called Ebola is Real. Two Liberian artists. It's a game changer. People stopped shaking hands. People started washing their hands. Dead bodies were being managed appropriately. It was a game changer. The song was Ebola is Real. Changed the whole nation.
And Sarah, what would you love to see organizations and supporting ecosystems do to ensure that we understand climate and public health in more actionable ways?
Yeah, so I've been working in environmental education for my entire career. And one of the criticisms I hear most frequently is that, well, this is a long game. You're not changing policy. You're not making systemic change that we need to make to address these really big issues like climate change and public health. I disagree. I have a really different perspective, and I think we've just heard some good examples on this stage that environmental education and making those personal connections, making these issues personally relevant, is absolutely foundational to getting to policy change and systemic change and those other things that we need to see. You can't do that without a receptive public. And that is the work that I think everyone on this stage is doing. So I agree with AY. I think we need more support for this kind of work. We need trust and flexibility from funders to let organizations like Hip Hop Public Health and NEEF and AY do the work and be creative. And I would love to see everyone walk out of this room and companies and organizations really value environmental education as the first step in a continuum that gets us to those really big actions.
Excellent. Thank you, John.